Well, hello and welcome to Senior Happenings. My name is Trisha Ayers and I'll be your host today. Always very excited to bring our seniors and our maybe soon-to-be seniors, I kind of put myself in that category, information about aging and all the things that are available to us in our Northwest Arkansas area. I am so pleased to be joined with my first guest, Dr. Bichala, who is an internal medicine doctor at Mercy. Welcome to the show.
Thank you, Trisha.
And I did get the name correct.
Yes, you
I
did.
have been practicing. Thank you. I appreciate that, practicing.
You were spot on.
So, Dr. Bichala, you are a internal medicine professional doctor
Yes.
of many years of study, and you are located in?
At the North Walton Boulevard location, Mercy Clinic.
Which is just really an extension of Bella Vista. Really
yes.
is. So, and we're going to talk about our beautiful seniors and the folks that you help in your practice. First, we're going to talk about, if you wouldn't mind specifying, what is the difference between internal medicine and family medicine?
So everybody gets an MD when we go through 5 years of medical school.
Okay.
And after that, we choose to specialize and postgraduate with training for 3 years. And those can be separate specialties or basic specialties. So internal medicine is basically adult medicine. So anyone, we specialize in treating anyone above 18.
Okay.
And it deals with more training in chronic conditions like diabetes, hypertension, peripheral vascular disease, heart disease, not the cardiologist level, but the primary prevention level. So internal medicine is more trained in that aspect of adult medicine, and family practice is like more they're the family doctors where they would treat the whole family, the parents, kids, grandparents for the usual day-to-day ailments, upper respiratories. They deal with labor and delivery as well, and prenatal care. So
Right.
I would say that would be the major difference.
Now, we are still coming out of COVID for our seniors, and for some of us who probably haven't taken care of our health through that time period. And now I'm sure you're starting to see our seniors who didn't get some things taken care of are now coming to your office. What are you seeing in your office?
I would say, I think everybody knows that COVID has changed us and changed the whole world and how we did things. So yes, people are tending to be still isolated, and when we have restarted opening up, it's not been in the true sense fully, I would say. I feel like a lot of people especially our seniors, they tend to downplay their symptoms, or they tend to kind of be dismissive about concerns either they have or others, family members are bringing up. So the main thing, I would say that is the sequelae of that, or the complications from that I'm seeing. More memory concerns, more falls, more isolation, more mood issues, more depression, and just even though they're not sick, they just don't feel well.
Yes.
So
yes.
I think that's a big
And I think you're right.
change.
Our seniors do downplay when they're not feeling well.
Yes,
Unless
totally.
there's something very serious.
They have to. It doesn't. It's just not a concept for them. I think that if I'm functioning, even though I'm functioning with a lot of difficulty,
Yes.
that's still okay.
Yes.
But that should not be the case.
Right. And
So-
we were talking earlier about memory issues and folks coming to your office. When should they start coming to, if they feel like dementia runs in the family, Alzheimer's, those telltale signs that this may be something that we need to look at? What are you seeing in the office, and when should people come and see you?
So the biggest thing I would say to people is that we need to be proactive about it. Once the memory issues and the dementia issues kind of set in, it's harder to manage or control. So it's more about being proactive about it. So we're not wanting to get anybody to that stage. We want to do things to prevent. It's more about doing preventative care to get to that, before you get to that stage. So all Medicare insurance plans actually now, not now, they've always done it, but I don't think people do it that much or are aware of it that much, especially our seniors, because I don't think healthcare back when they were younger had that concept, where they have the annual wellness visits or the AWV visits is something that they might hear in the clinics randomly, but those are there for us to address these concerns.
Yes.
When we say preventative care, a lot of people only think about, cancer prevention, heart disease prevention. No. When it comes to seniors, when we are talking about preventative care, it's about those things also, diabetes, heart disease, cancers. But along with that, we should be, and we aim to look at functioning. How are you doing at home? What are the social supports you have? Are you having memory concerns? What else tools can we use, or what else can you change in your lifestyle to make things better for you in terms of quality of life, not just prevention of diseases, but also improve your quality of life.
Exactly. And I think with the, what I find, and I am not a medical professional, but out there in the senior population, there's a lot of stigma that's attached to, now, if there was dementia in the family, they're going to get a guardianship as soon as somebody says something. They don't see that it can be a long path, and that it's not the stigma that it used to be, and there's a lot more resources available for people. I think that sometimes is the concern.
That's the point. If you actually do be proactive about it, then you will see that we actually utilize all the resources we have. I'm not talking just about medications. It's about support with day-to-day activities, being physically active, and trying to address the lifestyle issues that you might have, which would hamper future memory issues and stuff. So it's about not just about pill pushing either. It's about non-pill measures also, which can be discussed with your primary care provider.
So I want to ask about how, if I come to your office, how can I be a good patient? What can I have done before I get to my appointment to be a good patient?
Make a list of the things that you would want to talk to the doctor, because sometimes we forget. No, it's not about forgetting. You just don't think about it at those moments. So when you know there's a elective or a planned appointment coming up, make a list. I know access has been an issue for our senior population, especially with their primary care doctors. They've seen them for years, but nowadays they're finding that they don't have enough, they don't get to see them, or they don't have the time. But I do believe healthcare systems are listening to that feedback and they're addressing it. And how I work as a primary care, senior-focused primary care provider, that is a big deal. That is a big focus in my clinic. We have time for you, so don't feel rushed.
Right.
Make a list. No thing is nothing or little. It doesn't matter. At least discuss it with the provider and find out if it is a big deal or if it needs to be changed or addressed at all.
Okay.
So don't hesitate to ask. Also, if there is family members who want to be involved, bring them along. Take their support. I think that would be the basic thing.
the family support is really important, and I know that some of our seniors don't have that. They've moved here, they've retired here, and family is somewhere else in the world, but or the country. But also, one thing I love about Mercy is the different ways that you can connect with your provider. Exactly. So I'm sure that you could even organize a telehealth for a family member while mom and dad are in the office to get more of a picture of health. There are so many ways that you can get the right information to your provider, and so many ways as a patient that you can contact your provider.
Yes.
You can email them, you can telehealth, all kinds of stuff.
And phone calls are still there. I don't want them to think that it's different than what it used to be. You don't get the person straight away as soon as you call. But I believe the system is different now, and we are more responsive, and your callbacks are much faster and much more prompter. I am quite surprised, not maybe this is just my experience, that my senior care patients have been quite savvy about the technology part.
Yes.
We have a wonderful My Mercy tool, which people are actually accessing, and they send me messages, and I communicate with them through that also in between visits. And like you said, telehealth is a great tool. It's a little bit quirkier in the first time you do it, but I do believe a lot of seniors have not had that much trouble getting onto it.
And I especially think if you don't feel like you want to come into the office, it's a good starting point.
Exactly.
Probably.
So, many a times we ask our patients not to drive, so especially in those situations, don't depend on somebody to have to drive you all the time. No, we are there to do the televisits. If we still need you to come to the office, that can be determined later. But whatever the acute situation is, we will take care of it over the audio-video visits.
So you touched on it briefly, but what are some of the things that we can do as we're aging to be better stewards of our own bodies and not leave it up to you to fix? What can we be doing?
I think COVID in one way has made people more aware of what we were not doing.
Yes.
So there is a little bit more awareness about the importance of eating appropriately, exercising appropriately. But still, I don't think people focus enough on a good sleep, especially with seniors. It does tend to get harder with time, but we at least need to have like a routine. They're retiring, they want to do what they want to do, or they're available for everything. But it's important to pay attention to yourself. Self-care is vital. When you say self-care, eating on a timely basis, exercising on a timely, regular basis, activity cannot be underscored. I mean, in the importance of activity in preventing cancer, cognition issues, heart disease, diabetes, everything. There's too much evidence to ignore it. So the activity is great, but we also need to try and at least get 4 to 6 hours of sleep.
Okay.
And a regular sleep routine. And the other big thing I would mention is be your own advocates. Do your own things, and when you are going to your primary care providers, also advocate for yourself. Don't be afraid of advocating for yourself.
Absolutely.
And have a heart-to-heart
Yes.
with your primary care
Yes, be
doctor.
honest,
Be
and
honest.
tell them what's going on.
Because if you don't talk about it, nothing will change.
Right.
So,
Thank you so much. That's absolutely right. You've got to advocate for yourself.
yes,
So, Dr. Bichala, thank you so much for joining me today.
it was my pleasure.
And
Thank
you were on North Walton, yes?
Yes, North Walton
So
Boulevard.
if anybody is looking for a senior provider, North Walton Boulevard, go and see Dr. Bichala. She would love to help you age gracefully and take care of your medical needs. We'll be back in just a few moments, and we'll be dealing with a little mental health when we come back. Thank you so much. Welcome back to Senior Happenings. Sorry, I had a senior happening right there. Welcome back to the show. May is National Mental Health Month. We are excited to celebrate that. We should be celebrating that all the time, and hopefully we're going to continue to do that. So my guest is from Ozarks Community Hospital, and her name is Ashlea Ritter, and she has so many letters behind her name, so I'm going to read them off. Psychiatric Mental Health Nurse Practitioner, Board Certified.
Yes.
I wanted
You
to,
got it,
I
Jessica.
wanted the
You
board
added
certified. I love it. Ashlea, thank you so much.
Thanks for having me.
Thank you. And I was very excited when we spoke about the treatment that you're talking about today. So May, National Mental Health
Yes.
Month. Every month is
It should be.
every month should be. And you're talking about treatment-resistant depression. So
Correct.
how do you get treatment-resistant depression?
If you have been on multiple, technically 2 or more antidepressants,
Okay.
and your depression's not at a 0, people think that they get on, well, I used to be an 8 out of 10 depression. Now I'm 4. I can live with that. still pretty unhappy, maybe daily, but it's better. That's still depression. And so we consider treatment-resistant depression if you've been on 2 or more antidepressants and you're still depressed. Simple as that.
My goodness.
Mm-hmm.
So I'm just thinking here. So could it be the provider you're going to also?
You know, a lot of those classifications of drugs are very similar with one another. They deal with the serotonin in the brain, the
Okay.
norepinephrine.
Okay.
What we provide is a medication that actually deals with glutamate. It's a new drug. It's called Spravato.
Spravato.
It came out in 2019. It's been FDA approved for treatment-resistant depression, suicidality. If you feel like your antidepressants have failed you, you didn't fail them, they failed you, then we would do a psychiatric eval on you, and we would consider whether or not you were appropriate for this treatment. It's groundbreaking. I have seen magnificent. I always say this to my patients when they're coming in to talk. I've never loved a drug.
Right.
I love this drug. It has changed lives in more ways than I can count. I've seen it with my own eyes over and over again. Sorry if I'm rambling.
No, I love all the information. So the treatment, it's a nasal spray.
It's a nasal spray. So that's what's really different about
Yes.
this. It's not a daily pill you take.
Right.
This is you come in to our clinic. We have a nurse, our wonderful nurse, Shelley. She'll be with you the whole time you stay for 2 hours. At the end of the 2 hours, the side effects of the med will most likely always be gone at that point. You'll be safe to go home.
Yes.
It is a sedation. It has a sedation effect.
Okay.
So it's important that we monitor. We keep you on the monitors, and we have a nurse at your side the entire time in a very relaxed, calming, dark environment, and I have literally seen people come in suicidal over and over, not just once or twice, and leave that very day not suicidal. It's quick.
Wow.
You don't have to wait 4 to 6 weeks like you do
Right.
these other antidepressants.
Yes.
So, just saying, I know this is senior we're talking about, but if you have somebody who's postpartum depression,
Sure.
you don't want to wait a couple months for
Sure.
them by then their issues might be resolved
Right.
anyway. It's a very fast acting, twice a week for 4 weeks,
Okay.
and then once a week for 4 weeks. And then we talk and we stay close, and then we go to every other week. I have some people who do great weekly. I have some people who do great once every 2 or 3 months.
Right.
And it just kind of keeps that glutamate. The glutamate is a neurotransmitter that's one of the most abundant neurotransmitters in our brains, but we have yet to come up with a medication until now that really affects, that decreases the reuptake in it. So it enhances the glutamate in our brains, and glutamate very, very much affects depression and mood.
And even though we are senior related, we do want to share any information with
Yeah.
everybody.
Yeah.
We really
Yeah.
do. So going back to being a senior, though,
Mhm.
I will say seniors are the suck it up generation.
Absolutely.
Don't
God-
complain about
God
stuff.
love them. That's what I respect about them.
So
It's a double-edged sword, though.
yes. So how do we get our seniors to recognize that maybe there's something
Maybe,
going on, especially coming out of COVID?
Especially. I think that it's very important to realize that it's not a weakness to have depression or anxiety or any kind of
Yes.
mental health issues. It's a human thing. And our seniors have issues that we don't quite understand yet because we haven't. I see it all the time where, just life changes. If health is deteriorating, depression is not a normal sign of aging.
Could you say that again, please?
Depression is not a normal sign of aging. You don't have to go through life even though you've got new challenges. Maybe we've lost loved ones. Maybe you don't have the energy you used to. Maybe you don't have the energy you used to because you're depressed,
Right.
not because of aging,
Right.
which is one of the signs of being depressed. You don't enjoy the things you used to enjoy. Maybe you don't. Maybe if, simply put, you just feel sad
Right.
every day. You weight loss, weight gain. You want to stay in bed more than you used to. You
Yes.
want to stay in front of the TV longer and not go outside and enjoy life. And I want our people to enjoy life, enjoy their family and loved ones, and be active and social because they deserve to be.
Right.
And that's what we're here for.
And sometimes the depression is masking them being able to
Absolutely
enjoy
right.
things.
Absolutely.
So we need for people to advocate for our seniors, or seniors advocate for yourself.
Absolutely.
As you said, there's not a stigma. Please
Please.
go and reach out.
Yes. Reach out to us. You can look at our website. They can call their primary care provider to send over a referral for a psychiatric eval to see if they're appropriate for Spravato. And if they're not, then there are other, just sometimes going in and talking to somebody
Yes.
helps. I'm all ears. Whenever I call it my little bubble with my patients, it's just us. It's a confidential atmosphere. It's not going anywhere.
Right.
You can try. I know it's hard to go in and spill your guts to a complete stranger, but I feel like most of the time my patients, after the first hour, we spend about an hour and a half together, and after that, I don't see a lot of nerves after that point. And another thing, a lot of people find it comforting. Bring a loved one.
Yes.
I got a couch in there. Come sit down with your loved one, and we've got Kleenexes. If you need to cry, I'll laugh with you. I cry. If you cry, I'll start crying too, and we'll just have our time together. And if you want to bring somebody with them, they're more than welcome to if they want that support.
I think definitely it's making that first step.
Yes, that is most definitely the hardest thing. It is. It's a big deal. I ask a bunch of questions, and we just sit and talk about their life. And as far as Spravato goes, and depression, I really, if you've been on medications that haven't worked for you in the past and not worked completely, where you have no depression,
Right.
which I see that. My patients, not all, some of them do, it'll decrease 70%, and that's a win too,
Yes.
I mean, sometimes there are lifestyle changes and other factors that we need to consider as well, but I love when I hear, I'm not depressed anymore.
Oh, absolutely. And probably wish they had come sooner. That's the thing.
All the time.
Yes.
And so many people are just so used to it that depression's home for them.
Right.
They felt so many, well, I've been this way since I was a kid, it's not going to change. Well, it can.
Right.
It can.
I think we have to educate people that
Yeah.
physical health, mental health, it's all related.
Absolutely right.
So we need
Yes.
to do a better job of that.
Yes. Yes.
So-
And break the stigma.
You are located
We're at
Ozarks.
Community Hospital.
in Gravette.
In Gravette. The only hospital there. You won't miss us.
I love it. A well-established hospital.
Very much. Very much. I drive an hour to work. That's how much I love it.
Oh my goodness.
I have other places much closer to me, and I love that place so much because they give me time. They don't say, you have to see this many patients in a day. It's not all about that money.
Right.
It's about the patient and their well-being, and that means more to me than anything. They give me that time.
And who is your psychiatrist?
I actually have a psychiatrist over me. She's in Little Rock. Her
Okay.
name's Dr. Leanne Bennett.
Okay.
She's amazing. She's a wonderful, wonderful wealth of information and resource for me to have.
Sure. So if our seniors are listening and saying, that might be something that's not quite right, that I'd really like to go and see Ashlea.
Absolutely. Give us a call. We appreciate a referral from their primary care.
Okay.
If for whatever reason that they want to bypass that, sometimes people are too depressed to do a whole bunch of steps. Give us a call.
Right.
We'll talk to you.
You'll figure it out.
We'll figure it out. We've got our coordinator, Molly. She's our behind the scenes, the backbone of everything that we do. Another thing that now that I brought her up.
Yes.
We are one of the very, very few that take Medicare for this. This came out in 2019, and I always say it used to be only a wealthy, depressed people, medication, but it went from being cash pay only to commercial insurance, and we actually take Medicare
That is
and Medicare,
huge.
and that's huge.
Huge.
Yes, yes,
Huge. Seniors, are you listening? Covered by your Medicare.
Yes.
We love that.
yep. And Molly gets all of that stuff that I haven't a clue about taken
Yes.
care of for them. They just
Okay.
bring their card.
Well, thank you so much.
Thank you for
Ashlea.
having me. I
That is
appreciate it.
amazing news. Amazing news for our seniors, for everybody, really,
Yeah.
that there's some more options to depression.
Yes, and we're there for them.
And our seniors, it's covered by Medicare. You pay your supplements. Go do
Yes.
it. So we're going to go to Ozark Community Hospital, go get all of our medical needs taken care of there, especially our mental health. We're going to go and see Ashlea. I may come and see you. Yes.
Come see
I
me anytime.
think I have some of those. And I like the depression is not a consequence of aging. Thank you so much for joining us today, and I'll see you next month. Thank you so much.
Thank you so much.